Hi, my name is Dr. Gary Midelton. I'm the medical director at Formé Medical Center in White Plains, and I've been asked to talk a little bit about the new coronavirus vaccine. I got it myself on Friday, 2 days ago, and right now there are two on the market. No one will have a choice as to what they get because there are limited doses. So there's the Pfizer and the Moderna vaccine right now. They're both 95% efficacious. One small difference between them is the Moderna vaccine, there are two doses given 4 weeks apart. The Pfizer vaccine are two doses given 3 weeks apart. Also, the Moderna vaccine has been approved for anyone 18 years and above, and the Pfizer vaccine has been approved for anyone 16 years and above. The most common side effects that have been reported are arm soreness, of course, where the injection site, low-grade fever, headache, chills, fatigue. I have experienced none of those except for pain in the injection site, and I think it felt more like a tetanus shot when the evening that I first got it, and 2 days later today, it's now feeling more like a flu shot. Flu shot always is, at least in my experience, less painful. I have been asked by some of my colleagues if you can get it if you're pregnant. It is not right now approved for women to get it if they're pregnant. Doesn't mean they can't get it. The reason is they did not study any pregnant women when they were doing the vaccine trials. They don't think that it's going to cause any harm to the baby. They don't think it's going to cause any harm to mommy, but it just wasn't studied because they were excluded from the trials. They did look at animals, and they gave it to pregnant animals, and they did not see anything that turned out to be dangerous to the mother or for the babies. Another thing about the vaccine, you cannot get coronavirus from getting the vaccine. There is no coronavirus in the vaccine. What it has is something called a messenger RNA, and it is taken up by the muscle and then the lymph nodes, and you then will make antibodies to the little spike protein to the actual virus if your body ever comes in contact with the actual coronavirus in the future. So you cannot get coronavirus from this vaccine. There have been a handful of cases of anaphylactic reaction that have occurred since the vaccine has been released, and it's not, what they're saying is if you've had an anaphylactic reaction to anything that is injectable, an injectable medication or an injectable vaccine, that you can get this vaccine, but you should probably be monitored for 30 minutes to 15 to 30 minutes. Anaphylaxis usually happens rather quickly. It's not something that's going to happen the next day. It happens usually pretty fast. Certainly you can talk to an immunologist if you did have an anaphylactic reaction to anything that's injectable in your lifetime, and decide if you want to go ahead and take the vaccine. But to everyone else, the vaccine so far has proven to be safe and effective. Everyone that gets the vaccine is monitored for at least 15 minutes, and I was as well. Still here, it's fine. I didn't grow a third head, and I'm going back for my second dose in a month. So I urge everyone to get the vaccine if they can. If you do have a history of anaphylactic reactions to any injectable medications, to any injectable vaccine, you may want to talk about it with your doctor before getting it. You may want to be monitored longer, but again, it's still not a contraindication to getting it. And if you've ever had a reaction to shrimp or other oral medications, that is not a contraindication, and no anaphylaxis has been seen in people with those types of allergies. So I encourage everyone to get the vaccine if you're eligible for it. Thank you very much.